Good morning, friends. This is Dr.Suhas Bavikar, a transplant physician and nephrologist from practicing in Aurangabad since last 30 years. And after doing 1130 kidney transplants over last 29 years, I'd like to give some information to kidney disease patients so as to prevent or choose kidney transplant as a therapy. We need to understand that 17% of total Indian population, that is 135 crore people, will have some sort of kidney disease. So the number of Indian population having kidney disease would be around 30 crore. Of that, 1% of these people will have dialysis requiring kidney failure. So in effect, only 1 lakh people are on hemodialysis in India, that is CKD data registry. So 29 lakh people are dying without any sort of therapy in India. So there is a responsibility of government, kidney specialists, as well as the Indian patients or population, so as to fight this war against kidney disease. So to prevent kidney disease to progress to dialysis requiring phase, we need to control your diabetes, blood pressure, then obesity. You should not take addicting drugs, alcohol, painkillers, and there are many other things we should do. Apart from that, nephrologists and physicians should watch for their kidney disease patients for residual renal function, the amount of urine the kidneys are producing per day. So, and that should be protected. So, renal protection in CKD, not requiring dialysis, is the buzzword of 2019. Kidney disease protection can be done by specialists or as by physicians in only an aware patient. So, awareness of kidney disease can be reversed, arrested, or the progression can be slowed down for the patient by the physician is to be the key of success for preventing these diseases to progress to end-stage disease. The choice of renal replacement therapies one has to choose from is hemodialysis or peritoneal dialysis or transplant without going for dialysis. So kidney transplantation is said to be 100 times better than somebody going on dialysis, because only some, except some medicines, these patients are normal. Their hemoglobin is normal, their kidney functions are normal, their blood pressure is normal, their damage to your heart and other vessels and other systems will be reversed within 6 months of successful kidney transplant with normal kidney function. So the ideal therapy for kidney disease patients would be kidney transplantation. Choosing a kidney transplant is the best treatment. Now, there are 2 types of kidney transplants: live donor kidney transplant and cadaver donor kidney transplant. Ideally, if you have a live kidney donor in your family, then it is the best, because the quality of kidney you are getting, it can be assessed before transplant. In cadaver, offered a kidney which is of course healthy and good, but you are not aware of the person, the matching, and there are many other facets why cadaver kidneys are not good than live donor related kidneys. The transplant is the surgical procedure in the abdomen. We put a kidney and connect the artery of the donor kidney to the recipient's iliac arteries, and the donor kidney vein to iliac vein, and ureter to the bladder directly. So this surgery usually takes 2.5 to 3 hours under general anesthesia, and almost 99.99% times this is safe. There is very few patients' deaths are observed in modern times during surgery. After transplant, usually for 15 days, patient remains in the hospital when the drugs are monitored and dosages are titrated for that particular patient, so that the kidney and the patient's body work together with optimization of the drug levels in an individual. After discharge, once the wound heals, the patient attends the OPD twice a week for 3 months, once a week for next 3 months, and every 15 days for next 3 months, and monthly for lifelong. He has to take some medications, immunosuppression which is called, which will make kidneys work for that person and body not allow to reject that kidney. So this immunosuppression is the key to successful working of the kidney in that person's body. During this period or during lifelong, the person has to be monitoring himself with the help of the doctor for kidney function, for side effects of the drugs, and for infections. He has to look after his hygiene, his food intake, water intake, cleanliness, personal cleanliness, and he has to enjoy the life with working kidney and medications as advised by doctor. So, thank you.